this week.
And last one for me. Did you read, maybe you had a chance to see the Washington Post did a pretty interesting bit on the Obamacare exchanges. Again, they continue to sort of slide, the numbers continue to trend downward. What is the level of concern here at the White House right now about that? In particular, I ask because as Aetna and others, United Healthcare, continue to sort of shed participation, there is a criticism, at least among some of the folks who have to rely on Obamacare. The premiums keep going higher, the choices keep shrinking. Tell me what the president has to say about that.
Well, Kevin, I appreciate the opportunity to talk about this because I do think there is one important fact that, to the credit of Juliet's colleagues at the Washington Post, was included in the story. And it's simply this. It's important to understand the context in which the CBO was putting forward these estimates about the number of people that would sign up on the marketplaces. Right. CBO was based on an assumption that across the country you would see employers essentially kick their employees off of their health insurance and tell them to go sign up in the marketplace. The truth is that has not happened nearly as often as our critics predicted. In fact, what we have found is that the vast majority of employers have continued to offer health insurance to their employees, that their employees continue to see that as an important benefit. And this actually is an example of yet another of the worst predictions about Obamacare not coming true. So it's important for people to understand exactly the context of these numbers and what they show. That said, the administration is focused on making sure that we realize the potential around the marketplaces to expand choice and opportunity for people all across the country. And what is clear is that the vast majority of people all across the country will have access to a plan that costs $75 a month or less. And these are plans that are quality plans that meet a set of benchmarks that weren't previously available in an affordable way in the private insurance market. So we have made important progress in terms of expanding choice, certainly from before Obamacare went into effect, and we have made important progress in keeping those choices affordable for the vast majority of individuals who go to shop in the marketplace. What we have also succeeded in doing is putting in place important consumer protections that people who don't shop on the marketplace but still get health insurance from their employer benefit from. And that's things like free birth control and being able to keep your kid on your health insurance program if you're a parent until they turn 26. Yeah. So these are important benefits that apply to everybody, not just people on the marketplace.
But if you're Aetna and you're shedding millions, tens of millions of dollars, this hasn't worked out so well at all.
Well, if you're Aetna, you've actually seen your stock price more than double since the Affordable Care Act went into effect. And the fact is, there are plenty of other insurance companies who are competing for this business who are doing it right. So, look, I'll let executives at Aetna explain their business decisions and to explain their struggles to make this process work for their bottom line. Plenty of other insurance companies have figured it out and are put forwarding offerings that give the American people a choice when it comes to providing health insurance for their families.
So put a cap on it,
Sure.
even though there are